When the son of two of our friends was born, it was one of those moments that nearly gave them a heart attack because they thought that their son was born without testicles. What they didn't know is that it is not uncommon for baby boys to be born that way, as testicles grow inside the baby and sometimes only descend after birth. But if you don't know that, it's only natural to be worried, right? And so with this video, we want to help you understand what's normal when you look at your baby for the very first time.
Yes. So first of all, we are gonna share with you 12 visible characteristics of a newborn that may worry you if you don't know what to expect.
Yeah.
And then afterwards, we're also gonna share with you the 5 things that scare parents the most when they see them on the newborn and why they too are totally normal.
Yes. This is Natalie, a pregnancy and birth consultant and TCM therapist.
And that's Matthias, a researcher and science geek.
And we are here to help you and your baby naturally and science-based. So let's get started. If you are expecting a baby, you probably cannot wait to find out if your baby's got mommy's or daddy's eyes, unless they are the same, of course. And so some parents may be quite confused or even worried when they look into their baby's eyes for the very first time. The thing is, your baby's eyes are perfectly normal. What most parents don't know is that the baby's eye color may not reveal until 6 months of age or more. In fact, Caucasian babies usually have dark blue or even grayish eyes when they are born. Asian, African American and Hispanic babies, on the other hand, are almost always born with dark eyes which stay dark. But even in their case, the shade of the color may slightly change over the first year.
Yes. However, not all newborns are able to open their eyes right after birth. In fact, most babies have really puffy eyes after vaginal delivery. Well, that's because when you push your baby through the birth canal, there is a lot of pressure on your baby's face, which may cause it to swell. And that swelling can also affect your baby's eyes. And so sometimes a baby may not be able to open the eyes straight away. But don't worry, the swelling is totally normal and it will pass eventually.
Right. On the other hand, if your baby is able to open their eyes, you may find that they seem, out of line or crossed, if you will. But normally, this is not a reason to worry either. The problem is simply that your baby's focus is just poorly adjusted at the beginning. However, that is supposed to improve within the first 2 months.
Yes. And another thing that you may notice when you look into your baby's eyes are red streaks in the whites of the eyes. That too is totally normal and nothing to worry about. It's caused by pressure changes during delivery, which can make the blood vessels in your baby's eyes burst.
Yeah.
But they normally disappear within the first couple of weeks.
Yes. Another thing that many parents find disturbing is the looks of their newborn skin. And that's not a surprise, right? I mean, imagine being in a narrow tank full of liquid for 40 long weeks and then squeeze through an even tighter bony pelvis for hours before someone finally pulls you out and into a cold world. I mean, what would you look like, right? And so it is totally normal for newborns to have very wrinkly skin and buttocks that look like as if they're having cellulite. But most importantly, you may discover that your baby is covered with what looks like skin-related problems, such as the following.
Yes. So first of all, you may observe small white spots on your baby's face or chest. They are called milia or milk spots and they are very common on newborns. They are caused by blocked sebaceous glands that have the important function to lubricate the skin. However, they will normally disappear within 2 months after delivery.
Right. Mild acne is another skin problem which is often observed on newborns because some of the mother's hormones stay in the baby's blood. It may be something that you observe straight away or only some days or even weeks after your baby was born.
Right.
In fact, it is totally normal for mild acne to come and go over the first few months of your baby's life.
Yeah. Another skin-related problem that newborns often suffer from is called erythema toxicum. These are red blotches that you may find all over your baby's body. They too will come and go. However, normally they only appear over the first 2 weeks of your baby's life.
Yeah.
We know it looks serious, but trust us, it really is not.
Right. And since your newborn is the sweetest thing on earth, don't be surprised to find lots of angel's kisses on your baby.
Yes.
Hey, nobody can blame those angels, right?
True.
Angel's kisses is the term for those pink birthmarks that you may find on the back of your baby's neck, sometimes on the forehead, eyelids, upper lip, or on the bridge of your baby's nose. Actually, they're also called stork bites, but clearly we prefer the term angel's kisses here, right?
Definitely.
But to be perfectly honest with you, they're actually caused by stretching of blood vessels. They too are totally normal on newborns with light skin, and they often go away within the first 18 months.
Yeah. Babies with dark skin tones, on the other hand, often have birthmarks which are called Mongolian spots. These are basically blue-grey or blue-green patches of skin, mostly on the back or buttocks of the baby, but sometimes also elsewhere on the skin. They too are totally normal and usually disappear over the first couple of years.
Yes, another thing that's totally normal is dry skin. Babies lose their outer layer of skin right after they are born. Therefore, you're going to see flaking, especially around their extremities, feet, hands and ankles. No need to apply lots of lotion, just let it flake off.
Yes, and then some babies are born with a thick coating of white greasy vernix. Its purpose is basically to protect the baby's skin from that liquid environment in the womb. That too is totally normal, and it will either be cleaned off by the midwife right after birth, or it will fall off over the next couple of days.
Yeah, okay, and then here they are, the 5 things which scare parents the most when they see them on their newborn. So here's the first one. About 10 years ago, I received a phone call from a friend of mine. And believe it or not, he told me that his wife just bore a little werewolf. Back then I really didn't know what he was referring to, but what he meant was that his baby boy was covered all over with hair when he was born. Now believe it or not, but that too is totally normal.
Yes. It's called lanugo, which ranks 5th on our list of scariest characteristics of a newborn. Lanugo is the term for that fine downy-like hair that grows on your baby from as early as week 19 of your pregnancy. However, it normally starts to fall off before your baby is delivered. Nevertheless, you can sometimes still see spots with lanugo hair on your baby, particularly when you had a preterm birth.
Yeah.
But don't worry, your baby is not a werewolf.
Yeah.
The hair will fall off eventually.
That's good to know, yeah, thanks. By the way, if you're liking this video so far, we would be super grateful if you could leave us a like. Or simply subscribe to our channel if you want to see more videos like this in the near future. Thanks a lot. Okay, next on our list of scariest characteristics of a newborn is the shape of the baby's head after a vaginal birth. After a vaginal birth, the baby's head often looks cone-shaped or pointed. And so naturally, parents are going to be worried that their baby's head is misshaped and that something is not right with their baby.
Yes. However, that too is totally normal.
Yeah.
Because in order for your baby's head to move through the birth canal, the bones of the skull overlap, if you will.
Yeah, they basically slide over one another. It's called molding.
Yes. And by the way, for the same reason, you're also going to feel a diamond-shaped soft area at the top of your baby's skull, which is called fontanelle. It's okay to touch it very gently, and you also don't need to worry if it pulsates.
Yeah.
Both the misshaped head and the soft spot on your baby's skull are totally normal. In fact, the misshaped head will resolve in a matter of days. The fontanelle, on the other hand, should close over the first 18 months of your baby's life.
Right. Next on our list of scariest characteristics of a newborn are blue hands and feet. Obviously, most parents are going to be worried when they see that the color of the baby's hands and feet is just not what they expected. But don't worry, you did not just give birth to a Smurf. It's a phenomenon called acrocyanosis, and it can happen as a result of an underdeveloped blood circulation of the baby. In fact, they may stay bluish for several days. And by the way, while bluish hands and feet can be normal, blue coloring of other body parts is usually not normal and requires further checkups by the medical team.
Yeah. The second scariest characteristic of a newborn are swollen breasts. Now, unfortunately, we don't have a picture of that phenomenon. But basically, both sexes can have a breast enlargement during the first couple of days of their lives.
Yeah.
And one thing that can add to raised eyebrows is the fact that a milky substance may leak from their nipples. Yes, that too can be perfectly normal. It's caused by the mother's hormones, and it will disappear very soon.
Yeah. Okay, and then here it is, the very newborn characteristic which parents find scariest. Swollen genitals and discharge. And obviously we don't have a picture of that phenomenon either, but basically both boys and girls may have swollen genitals when they are born, which is once again caused by the mother's hormones.
Right.
And the reason why parents find this so scary is because in their minds they basically just said goodbye to potential grandchildren, right?
However, swollen genitals too are perfectly normal.
Yeah.
In fact, baby girls might also have a small amount of whitish or blood-tinged discharge in the first few weeks of their lives. Baby boys, on the other hand, are often born with swollen testicles or no testicles at all.
Right.
Their testicles may have simply not descended into the scrotum yet, which is particularly often observed in premature baby boys. However, in both cases, your baby is normally absolutely fine,
Yeah.
and you don't need to worry about not having grandkids.
Yeah, right. Remember, the 12+5 characteristics of a newborn that we just described can all be totally normal and are normally not a reason for you to be worried.
Right.
However, as always, do have your little baby checked up regularly by a doctor and report anything that you may find unusual or which may indeed be a reason for you to worry.
Right. And if you want to see more videos like this in the future, then we invite you to subscribe to our channel and to hit the bell so you don't miss any of our videos.
Yes. Also, if you have liked this video, we would be super grateful if you could leave us a like or even leave us a comment in the comment section below. Thanks so much.